So good evening, everyone, and welcome to this webinar on facing
Ma'am, hold. The webinar is live now.
So good evening, everyone, and welcome to this webinar on facing and acing an interview. So we've learned surgery for many years, complications, presenting at conferences, but no one really teaches
for
us.
me, it was always my teaching.
Yes, so nobody really teaches us to answer questions like, where do you see yourself in 5 years? And especially as women, how do we answer? Do we want to sound ambitious, too ambitious, or not ambitious enough? So I think this webinar is going to start discussions, and we're going to gain insights into topics that are usually not touched upon commonly in our conferences. And to start, I would like to invite someone who has worked consistently to support, uplift, empower women in our field. Do we have Dr. Swati, ma'am? Can you please give the opening remarks for the webinar?
Thank you so much, Ridhima, and welcome all the special guests, the panelists, the speakers, and everybody at Young WOS. This is this society is of youngsters for youngsters and anything that the youngsters feel. So we welcome you all to this, and we have Dr. Mohita joining in. So probably, Dr. Mohita, would you like to say a few words before we get on to the sessions?
Good evening, everybody. And once again, we are happy that this webinar is happening, and this is for young women ophthalmologists. And again, as Dr. Ridhima just said, there are some topics which are not taught to us in curriculum and which are not discussed in conferences. So one of such topics is facing and acing an interview, because we do learn everything in as far as clinical is concerned, but nobody teaches us how to face an interview. And so when we are taken suddenly we face an interview, we don't know how to conduct ourselves, we don't know what to expect, and we don't know how to put the best version of ourselves forward, such that we actually ace the interview. And for this, two very good speakers, I think nobody could be better than them. Dr. Muna Bhinte and Dr. Ritika Sachdev are with us. So first of all, thank you so much, ma'am, and thank you so much, Dr. Ritika, for being here, because I think this is the best possible opportunity that any young woman ophthalmologist could have got with you both being here. And of course the special guests and the panelists who are again authorities in themselves. And let's just not take any more time, and we are all excited to hear. In fact, I'm also excited to hear how to face an interview and how to ace it, and what the two speakers are going to tell us. Thank you. Over to Dr. Ridhima or Dr. Swati.
Yes. So, Dr. Rakhi, can you please introduce our next guests?
Yes.
Yes. So we have special guests with us today.
Continue to share. Can you please press continue to share? So it's my proud privilege to introduce Namrata Madam here. Yeah. So Namrata Madam actually needs no introduction. Everybody knows her. She is working at RP Center, and she has multiple publications, multiple awards, and she is like a somebody who we all dream to be. She is like an overachiever, and we all truly love her. So we are actually very honored to have you here today, ma'am. And then we also have Dr. Dibakant Mishra, who is currently the president of YOC, and he's also the director of Swarnajyoti Eye Hospital, Lucknow. He's head of retina services there. And Dr. Dibakant is a very sweet person, and he is always very helpful to all the young ophthalmologists. We're very happy to have you here, sir.
We also have an eminent panel of judges that are going to judge the reels that a lot of young women ophthalmologists have prepared for this topic. So we're going to quickly run through the panelists that we have. Dr. Bibhuti, if you could start.
Am I audible?
Yes.
Yeah. So, hello everyone. I'm Dr. Vibhuti Kashyap. So first up, we have Dr. Kirti Singh, who is the Director Professor of Ophthalmology at GNEC, MAMC, New Delhi, and she's the ex-director of GNEC. She graduated from Lady Hardinge Medical College with distinction, and she did a post-graduation from Dr. RP Center. She is a glaucoma specialist, honorary faculty, medical education, microsurgical skills training, occupational and environmental health, multiple awards, multiple honors, multiple presentations, and a fantastic stage presence. We welcome you, ma'am.
Thank you. Next, we have Dr. Chaitra Jaydev with us. I've had the pleasure of working with her in Narayan Nethralaya. She's currently a senior consultant of Vitro-Retina there. She's done her PhD. She's not just a great academic profile, but she's great at multitasking. She can do like 25 things at the same time. So welcome, Dr. Chaitra. Thank you for accepting this invitation. We also have Dr. Mahesh Babu with us. He's the professor and head of Department of Ophthalmology at the Shimoga Institute of Medical Sciences. He's also a very active member of the Karnataka Ophthalmological Society with a lot of accolades to his credit. Welcome, sir. Dr. Nupur, are you there?
Yes, Dr. Ridhima. Hi.
Hi.
So it's my honor and privilege to introduce Dr. Rishi Swarup. So he is a medical director and chief surgeon at Swarup Eye Center, Hyderabad, and a lot of awards and accolades to his credit. He's also the chairman scientific committee Telangana Ophthalmic Society and the past honorary secretary of Hyderabad Ophthalmic Association. So welcome, sir.
Dr. Bibhuti? We also have Dr. Shalini Mohan ma'am with us, who's the
Oh, I'm so sorry. I was keeps getting muted. So we have Dr. Professor Shalini Mohan, who is officer in charge of glaucoma and director Eye Bank, ex-HOD of GSVM Kanpur. She did a senior residency from AIMS New Delhi, and she has been a consultant at Sir Gangaram Hospital in 09. She currently is the CSC of UP Ophthalmic Society and editor of the glaucoma section, AIOS Dynamic Book. She is the member of FBS Women Empowerment and Networking Committee, honorary secretary of IMA Kanpur. She is also standing for member scientific committee, I believe, and we welcome you, ma'am.
We have Dr.
Thank you so much.
With us. She's assistant professor of ophthalmology at the ESIC Medical College and Hospital at Faridabad. She's an anterior segment medical retina and oculoplasty specialist with a lot of creative interests at heart. Welcome, ma'am. And last but not the least, we have Dr. Aarti Heda, who's a dear friend. She's done her fellowship in cataract refractive surgery from Narayan Nethralaya, but she's also done many fellowships, FRCS, FACS, MRCS. She's a very enthusiastic member of the WOS Society of India, the MSICS. She's also recently written a book called Doctors Are Not Murderers. She has a very small newborn child, but she's here with us today, and I'm very glad to have you here, Aarti. Welcome. I'm quickly going to run through the moderators. Other than myself,
so I'll introduce you, Dr. Ridhima. So this is Dr. Ridhima, dynamic member of the team Young WOS. So she is currently director and pioneer at the Pioneer Medicine Pune and director at Nayan Jyoti Eye Care Pune. She's also the joint treasurer of the Pune Ophthalmological Society and ex-consultant at Narayan Nethralaya, Bangalore. And it's a pleasure to have Dr. Ridhima and the team. Thank you, Dr. Ridhima, and kudos to you for coordinating this whole event and this webinar tonight. So, yeah.
Not without your help, Nupur. So Nupur has done her fellowship in oculoplasty from the L.V. Prasad Eye Institute, and she's currently working as a consultant anterior segment oculoplasty at the Eye Care Eye Hospital and PG Institute, Noida. She's active on various She does so many things and she's so quick to respond, and she's helped and guided every step of the way in this Young WOS group. So thank you, Nupur. We also have Dr. Sonali Sahu, who's completed an MBBS from Indore, and her main areas of interest are ocular inflammation, allergy, and she's currently a consultant in cornea and refractive surgery services at LV Prasad Institute. She's also one of our members of the Young WOS team. Next, we have Dr. Vibhuti Kashyap, who's the Deputy Director and Head Retina Uvea Services at the Kashyap Memorial Eye Hospital, Ranchi. He's currently campaigning, very busy, very enthusiastic, winner of 2 Red Buckler trophies. So very glad to have him on the team as well. Next,
you
we
so much.
have Dr. Rakhi. She's a consultant phacosurgeon and medical retina specialist in Kerala. She's currently doing a parallel webinar of YOSI at the same time. So she's juggling both, as well as Dr. Prasanna. He's also a part of the parallel webinar, but we're so glad to have him on board in the Young WOS team as well. So quickly, we're going to move on to our first invited talk, and I would like Dr. Nupur to introduce our first speaker.
So it's an honor and privilege to have our first invited speaker, Dr. Mona Ghinde ma'am. So she's a consultant with Retina, and she's done a fellowship in VR surgery. So she's fellowship trained with retinal surgery, and she's working in Sankara Netralaya since 1994. And her current profile involves medical and surgical management of patients with retinal diseases and teaching and training of fellows and postgraduates and research in retinal diseases. I think we couldn't have had a better a speaker for talking about how to face an ASF fellowship interview. So without further much ado, over to you, Dr. Mona, for your talk.
Ma'am, if you can share your screen.
Yeah, can you see my screen?
Yes, ma'am.
Yeah, so good evening, everyone. This is an unusual role for me, and it made me think a lot about fellowship interviews, which are a lot different now than they were for us. So thank you, WOS, for making me think about this. My talk will be a little gender neutral, except for maybe a couple of slides, so forgive me for that. So I think the first thing is, when you want to do a fellowship, ask yourself why. There are many reasons, but probably the best reason would be an interest in the subject developed either before or during your post-graduation, inspired by your teachers, conferences you attended, webinars you listened to, some research work you did as a postgraduate, even personal encounters as a patient or relative of a patient, which is not as uncommon as you think. And of course, this is the best reason. You could be inspired by former fellows of the institute who could be your teachers, your seniors, acquaintances, or even your parents. And we all love this kind of good feedback. Then there is another category where you already have a setup waiting for you, and probably you need an additional label saying that, yes, you did your fellowship. This may not be the best reason, but definitely if there is a right attitude, it will work wonders. Then there are this group of, I can't say conditions, but yes, people who think that postgraduate alone gets you nowhere. This is not true, because it depends on what you want to do later and where you want to do it. You don't have to have a fellowship to practice comprehensive ophthalmology. Another thing which is not the greatest reason is, no, I didn't see fundus when I was a postgraduate, so I'd like to do a vitreoretina fellowship. No, this is not the greatest reason. And there is also a group of people who, yes, finish post-graduation, they want to settle down a few years later, so why not do a few fellowships along the line? Because there's less responsibility, and then you're free to take your leave and holidays within limits of the organization. And then there are people who are waiting to go abroad, waiting for senior residency, waiting for a government job, and think this is a good way to pass the time. Again, a big no, because it shows through in your interview. Now, all your homework has to be done before you even apply. What specialty are you really looking for, and is there a long-term plan ahead of you? What kind of thing are you looking for? Do you enjoy research, teaching, and academics, or you just want to see patients and operate? There's nothing wrong with either. It's purely a personal choice, but ultimately it does dictate where you should go. Look at small practices. They may offer more surgeries earlier on. You may get more hands-on experience, but probably the variety and depth of exposure may be less, especially if there are only one or two people in that practice. You do it in a large institute, there is more variety, there are more faculty, so you get a larger exposure, but your surgical exposure could be graded, maybe more supervised, and your focus could be divided between clinics, surgery, research, and academics. And then the kind of place you go to, is it a government hospital, a charitable hospital, a corporate hospital, or an academic? The volume of independent surgical work and the degree of supervised training and the amount of research and academics will definitely vary for obvious reasons. Now, there are certain WhatsApp groups, you have Instagram, you have websites. I just went through a website called Indian Ophthalmology, which gives you reviews on fellowships elsewhere. They may guide you to some extent, but you need to remember that not everyone gives a balanced view online. And you're more likely to share a bad experience and frustration than a good one. And when I Googled for fellowships, vitreoretina, ChatGPT forgot Shankar Nethralaya. And then when I asked it, why did you skip Shankar Nethralaya? ChatGPT apologized to me. So even these may miss good training programs. You check the website of the center that's conducting the fellowship. Are they offering what you really want? And something very recent, I have talked to a few people just out of post-graduation. If you think that fellowships are labor camps where people want you for free labor, remember fellowship is your choice. It's not a necessity. You're free to choose fellowships which teach you and give you a little stipend versus fellowships where you pay for each case. If you think fellowships are a labor camp, then maybe the latter is a better choice for you. And try and connect with more than one person who is doing or who has completed fellowship, because a single opinion may be biased, either good or bad. So speak to more than one person. Check out the requirements. Your basic qualifications could vary. And most institutes, especially ours, want you to have at least a provisional pass certificate along with your application. There is an age limit for applications. I think 35, 40, these are common age limits for obvious reasons. And each institute has its requirements and practices. Don't call up and argue with the education team that they are wrong. And while applying, work on your CV, because this is what is looked at during your interview. Make it honest, relevant, easy to read, because we sometimes get 100 applications. So it should be something that is easy for somebody to read through. Avoid flowery language and self-praise. Maybe apply for a maximum of 2 subspecialties you are really interested in, because sometimes there is a common application form. And if we see someone who ticked each and every box, it really indicates lack of focus, and the interviewer notices that. Mention if you're doing any fellowship that is ongoing. Are you in a job? Do you have a government bond? When is it likely to end? Can you break the bond? And also mention needs for permission, NOCs, etc. Add on research work, presentations, awards, with a short note on the ones that are relevant to the specialty of your choice. And mention your role in each one of them. Hobbies and other interests are definitely important because it makes you a well-rounded person, but please keep them brief. They may not be of much relevance to the interview. And do not shower undue praise on the institute you are applying to, because most people see through that. though you may mention how training there will help in your future career plans. And very often, your application forms are handwritten. So take care when writing them. Make a Xerox copy or take an extra printout, write out, do your scratching, erasing, changing, and then make a fair copy. A neatly written application form conveys a lot. And then you prepare for the big day. And this slide was shared with me by my good friend Meenakshi. Arrive the evening before, avoid excessive food or alcohol, especially trying out street food which may not agree with you. Get a good night's sleep. Calculate time to get to the venue. Don't plan that your flight will land 1 hour before reporting time. Arrange all your papers and documents. Book a cab. Set out your clothes. And keep a double alarm so that you get up in time. Now, most places have 2 parts of the selection process. Part 1, which is usually a written test or MCQ. We use it as the first filter. And this could be postgraduate level and maybe a little more. It's basically theory and a little bit of thinking skills, a mixture of basic science, research questions, clinical trials, investigations. It's usually theory-based. And I asked a few of my fellows, and they said the interview was much easier than the MCQs. And depending on the number of applicants versus the seats, all those who take the test may not be selected for the interview because sometimes we take a percentage. Say you have 4 seats, we may say take 16 people for the interview. And this could be variable when you have high demand fellowships. And this part 1 used to be online during COVID, but now we've moved to an in-person part 1, at least in our institute. And once you're selected for the interview, just prepare for it. Appropriate attire. I'm sure now everybody knows quite well the dress codes in various places. Appropriate, something you're comfortable in, and something that's appropriate for the weather. Be well-groomed, but don't overdo it. I think all of us are looking just for a pleasant, intelligent, hardworking, committed fellow. Need not wear a white coat unless specifically asked for. And beware of body odor, long nails, dirty nails, chipped nail polish, unkempt hair, cigarette smoke, pan stains, and dirty shoes. Arrive early, have a good breakfast, don't starve. And go through your CV, especially details you have shared about your experience, your research work, your thesis, because a lot of the interview is on that. Expect to be asked about them. So if you've committed to them, make sure you know what to say about it. What is the interviewer looking for? Your motivation and suitability for the program. That is a big thing. Your clinical reasoning skills. You don't have to be a genius, but you should be able to reason out your answers. Inclination or potential towards research and academics. This could vary based on the type of interview you're attending. Do you come across as a team player? How well do you know your CV? Here, some people may make their CV, some may not. So it's important to know exactly what you've written on it. Your soft skills, language, communication, your confidence, honesty, and do you make eye contact? And most interviewers, including me, are usually looking for at least a couple of potential faculty long-term among the candidates. We would ask questions like, say, I will ask why retina, why VR. My colleagues will say why cornea, why glaucoma, why plasty, why peds. What is your background knowledge or exposure? And for us, indirect ophthalmoscopy skills are a big deal. What is your general surgical exposure as a postgraduate? We do not expect specialty exposure. Of course, it's a big plus. How many cataract surgeries have you done? Are you aware of the kind of complications, difficulties you had? Are you good at handling emergencies? Because retina, a lot of retina is emergency. Have you given intravitreal injections? Have you done lasers? And also, do you know the difference between medical retina and vitreoretinal surgery? Because these are two different specialties altogether, though the vitreoretinal surgeon does learn medical retina. Medical retina is an upcoming non-surgical specialty as well. And which one you're actually looking for? If you don't have much of an exposure in vitreoretina, probably a medical retina fellowship to start with would be good. And of course, why this institute? Be honest about it, be frank about it. If it's from your city, say so. It's only because it's from my city. If your spouse is doing a fellowship, say, yes, my husband or my wife is doing a fellowship, I would like to spend time with them. Have you made previous attempts? Have you been selected for fellowship elsewhere? We have very common people selected moving from one institute and the other, not very appreciated. So be honest about it. Yes, I got selected there, but I would like to stay here. I mean, there's no harm. What about your family? Are there any health concerns? Be honest about it before you start. It doesn't mean that you won't be selected, but yes, people would look out for you. What is your current employment? Are you doing a fellowship somewhere else? Are you on a government bond? Now, the government bond is a big issue, especially people in government service, because they take a long time to get approval and may never get approval to do fellowships. Now, coming to your clinical reasoning skills. For us in retina, we would ask common clinical situations like diabetic retinopathy, vascular occlusions, AMD, ROP, endophthalmitis, retinoblastoma. And a common thing you need to know is what if versus so what. What if there is fluid? Yeah, I want to treat it. So what? Reduction in fluid can result in improvement in vision. So we are looking for that kind of reasoning skill. And if you're a prolific cataract surgeon, you would have had at least your share of some kind of complications. How do you differentiate between inflammation and endophthalmitis? Most important, regardless of your specialty. What are the basic management principles for retinal detachment? The common clinical trials and their applications, you need not know the laundry list. Just a few of them, recent ones, are more important. And yes, public health national programs like NDCB and universalized screening are things you need to know about. Most of you would have read it for your exams. Now, this is what I got from my colleagues in other subspecialties. The cornea department wants you to have a basic knowledge of microbial keratitis, stains, smears, allergy, dry eye, ectasias, degeneration, dystrophies, and basic surgical principles. And glaucoma will ask you for terminologies, disc evaluation, kinds of glaucoma, management of angle closure, clinical trials, medications, the old and the new. In oculoplasty, they would like you to know a little bit about ptosis, proptosis, and socket management. And of course, if you're not good with handling babies and children, probably pediatric ophthalmology is not for you. We do ask you to fill up a form which would tell you about your examination and investigational skills. Be honest about it. We ask about observation and performing and how you would grade yourself. But we would also ask questions on when and how you would evaluate a patient systemically, say a diabetic who's not responding for treatment, or you're evaluating a patient prior to surgery, what exactly would you look for? And if you have performed any investigations like OCT or FFA, then we are likely to ask you whether you understood the procedure and how to interpret it. Similarly, for other investigations like OCT, FFA, ultrasound, visual fields, and topography. Surgical skills. Definitely weightage for specialty procedures, either assisting or performing. How you would handle instruments and equipment, how do you focus the microscope, how do you sterilize? Basic understanding of the cases that you've done rather than the total numbers. What were your challenges and how did you overcome them? How did you handle your PC rent, or how did you handle premature entry into the anterior chamber? Do you know the basic principles of wound repair or suturing? And knowledge of ACTAP, intravitreal antibiotics. Many of you say, yes, I gave these injections. What did you give? How did you follow up the patient? How did you dilute the drug? And the answer is often the sister gave it to me. So I think if you claim to know something, you should know how to did it. Most importantly, there are a lot of non-surgical specialties available. If surgery is not your forte, be brave enough to accept it. And remember that many brilliant and celebrated ophthalmologists are not surgeons. Expect to be asked about your papers and presentations. Know your thesis inside out. Have a basic knowledge about statistics and clinical trials, because most of you would have done something in your thesis. And we would also look at your inclination for teaching and research. And some personal questions are inevitable. You cannot get out of them. It is quite justified, because after all, you're going to spend 2 or 3 years with the center. But these are usually confined to general queries, and very rarely does it get too personal. We may ask your future career plans. You need not dramatize it. If you don't have it, you say, I don't have it. Especially if there are children, we would ask for family support, because definitely family comes first. If your family doesn't support you, it's very difficult to have the institute to support you. Your spouse, your parents, your in-laws, your nanny, who is going to take care while you're at work? And there are a lot of people who plan a fellowship after a break from academics. And of course, we do ask them, how do you think it will feel to be back as a student older than some of your colleagues? These are not vindictive questions. They are genuine questions to check how interested and how likely the person is going to be fitting into your fellowship. How are you going to deal with your current employer or your government bond? What are your language skills, and how adaptable are you to new regional practices? Many people are concerned that if they come to Tamil Nadu, they have to know Tamil. And I tell them, no, it's okay if you know Hindi and Bengali, you can still get along. Be honest about constraints, challenges, and competing fellowships that may be there. We appreciate that. And if you have queries, you can always ask. And once the selection list is out, you're selected, you want to join, congratulations. But immediately communicate with the education team by email, whether you're accepting or declining the offer. Do not limit communication to phone calls and WhatsApp messages. Inform them if there are any concerns or likely delays in acceptance. People are more understanding than you think. And do not use terms like I'm unable to join due to personal reasons. Every reason is personal. Do not bargain if you have not been selected or you got something you don't want. You feel free to say, I don't want to join. And do not pass comments about other selected candidates. If you haven't been selected, there's always a waiting list or a next time or another place. Don't lose heart. Don't call up and argue with the education team about the selected candidates. And a big no-no, do not write nasty emails or put up social media posts out of frustration. You will lose whatever little chances you had of getting the seat, because dropouts are not as uncommon as you think. So a fellowship after post-graduation is an opportunity for you to upskill yourself in your chosen field, and in most places get paid for it. But do it only if you have good reason to do so. Have a genuine interest in the subject with a burning desire to be the best in your chosen field. But don't use it as a stopgap just because you don't know what to do next. If you think it's cheap labor, don't join. Once you join, don't crib about it. And remember, it's very difficult to get expelled from a program. However bad you are, people will allow you to complete unless you've been really negligent. But extremely easy to waste the years of your life that you have invested in it. So don't waste it. And make the most of these years. You may never get the chance again. So my friends and colleagues, Dr. Meenakshi, Smita Vittal, Shanta, Sumita, Bhaskaran, Radhika, and Kirti gave me inputs on their fellowship interviews. And my fellows this month, Polomi and Nitya, told me about their experience with interview. And of course, probably the best vitreoretinal team ever, my team at Shankar Nethralaya. Thank you so much for inviting me and allowing me to share my thoughts on this topic.
Thank you, ma'am. This was as elaborate as we could think, and an amazing insight on the fellowship program and how we should prepare. Because, I wish we had somebody like you to guide us before we went for our fellowships. And I'm sure every young person would. It's a treat to watch this talk, because I think you covered almost everything here. And we have Dr. Rishi with us, who himself has done a fellowship from a very premier institute, LV Prasad. So, Rishi, your thoughts on, for the youngsters to how to go about, you know, for the fellowship interview, and what would you like to add on?
Swati, I'll just correct you there. I did my fellowship from Shankar Netralaya. I don't think
Yeah.
Dr. I would have been happy to hear LV Prasad there. I was a
Yes.
consultant at LV Prasad.
Yeah.
But I've been lucky to be exposed to great institutes, including CMC Vellore. And I think when you're facing an interview, most of the things were covered very nicely by ma'am. From a cornea point of view, I can tell you that what one would be looking for in hiring a cornea fellow is, in addition to what ma'am mentioned, I think one more thing which we are seeing grossly lacking in many people who are coming in for cornea fellowships is they don't know how to suture. So it would be good if you have practiced that at least in the wet lab before you go for your fellowship interview. And because when you're asked if you fib, the people who are interviewing know how to make out if you're lying. So it's always
Right.
good to actually do it and be honest about it. So I think that is one of the things that in cornea fellowships people are looking for.
Right.
And like ma'am mentioned several times again, over and over, you have to be honest.
Yeah.
And they will certainly be looking for some exposure to the publication. So if you're going to an institute like LV Prasad, there are a lot of landmark publications that have come out of there. You should know about the publications that have been done in that
Right.
class. And you're certainly going to be asked about them. And if you don't know, then that's definitely a minus point for you.
Right.
Yeah. So, I mean,
Yeah.
and of course, there's no substitute for the subject. People are looking for a lot of things, including your personality and extracurriculars and how you come across. But your subject should be good. And that I would say is going to carry 50% of the weightage.
Correct.
Yeah.
I agree with you, Rishi, because being honest in your fellowship is most important. If you've not done a surgery or seen a surgery, there is no shame in admitting that I have not
Exactly.
been
Yeah.
exposed to that. And that's what the fellowship is all about. So that's perfectly, yeah. So, Dr. Chaitra, since you are already taking a lot of interviews of these fellows, and obviously you have come across a wide variety. So, what are the key features that you see, when you take somebody for a fellowship in such a prestigious institute as yours?
Yeah, hi Swati. Thank you for the opportunity. So there were two things that I wanted to add, and then of course respond to your question. One thing, ma'am spoke about very nicely about personal questions. So I think that becomes very important because we do have a lot of fellows who drop out midway because they plan families. So I know it's a very delicate thing to do, but it's a very important 2 years or 1.5 years. And we've had to lose good fellows, and they lose this opportunity. So that's something that we also discuss with our fellows, that some of them of course have completed their families, and it's a very important time in their personal life also to plan. So that's a little
Right.
delicate, but we need to discuss that in the open as well. And to add to what Rishi was saying, you're going to LVP for an interview, you don't want to know what work they're doing. And I would advise girls and boys who are coming for interview to also see whom they're going to be interviewed by. Very often they know. And if they know a little bit more about what work that person is doing, suppose I'm interviewing them or Munna ma'am is interviewing them, and if we can actually bring out something that ma'am or I am working on, it becomes a very, very relevant thing that we know that this person is actually there, has taken the trouble to go and read about something that I'm working on, and that would be a good discussion point, something that I'll be interested to talk about, that lab brownie points. So that those are two things. So what we look in them is not really the experience that they've already had as a PG, which is actually very, very variable. Some of the PGs who've had the worst training turn out to be the best fellows. What they need is that passion in that subject. It is very annoying when you ask them why retina and or what do you want to do. I can do retina, I can do cataract, I can do
Yeah.
glaucoma also. I mean, so they're trying their
You're
hand
not
at everything.
focused, right?
Yes, I'd rather a child say that, I'm so interested in doing retina that I've read a lot of it and come, and you get to know, the
Right.
enthusiasm and the passion.
Yes, of course. So, a quick comment from Shalini. You are here, and I'm sure from the lot of postgraduates would ask you that you are very closely involved with the postgraduate system and of a government medical college. So, what tips do you give to these residents that how they should pursue, when they should start thinking about it? So, any thoughts on this?
Thank you, Dr. Swati, and thank you so much for having me here. That was a wonderful presentation and lots of learning, I'm pretty sure, for all the postgraduates. So, like you said, preparing beforehand is extremely important. Whenever they are going to appear for interview, once they are well prepared, they are confident enough to answer the question. Another thing is whenever like they are answering something, so suppose they are unable to do it, it is better to take a pause. Rather than fumbling over there, think about it and then answer. Another thing I will say that always they can prepare a mock interview kind of thing, like the star method, which is said that like, what is situation you are going to get accordingly. Like if you are going for a fellowship, what questions you are expecting, you can prepare with your friend, with your family member. Then also, what task are you asking for? Like first T for task is there in star, then A for action. That how would you actually act upon that particular situation? What you are going to do? These questions are commonly asked in any postgraduate examination or any postgraduate interview. And finally, one thing I would also mention is that whenever like interview you are going to face, it should not be a one-way communication. At last, suppose the interviewers ask you that anything you would like to ask. So you should also have question that what is expected out of me, what are the targets I will be getting at the end of 6 months, what am expected to complete, what I'm expected to learn. That way, the interviewer will feel that yes, you are aware of your fellowship, you want to learn something, and you are expecting some result out of it. So that way, I think you can create a good impression and by a by-way communication.
I think very well said. I think they're very useful tips for the postgraduates as well. Ridhima, we may now move on to our next speaker for the day.
Dr. Rakhi, can you introduce our next speaker, please?
Yes, yes. So our next speaker for the day is Dr. Ritika Sachdev, who is currently director at Center for Sight as a cataract, cornea, and refractive surgery specialist. She has done her MBBS from Lady Hardy Medical College, Delhi, and she has also completed her cornea, cataract, and refractive fellowship from RP Center. So she has also pursued a management course in INSEAD, which is one of the world's top business schools. She is a renowned speaker in major national and international platforms, which include APSCRS, AZRS, numerous ones. And she has numerous awards and honors to her credit, which includes a lot of gold medals, as you can see here. So we are very happy to have you here, ma'am.
Thank you, Dr. Rakhi. And thank you, Dr. Mohita, for the kind invitation. I'll just be sharing my screen. So I'll be talking about a corporate interview. Remember, corporates are looking for something different from what you are looking for in a fellow. When you're giving a fellowship interview, of course, the basic tenets of being a good clinician, a good doctor, a disciplined professional do continue to be very important in a corporate interview. But we are looking for somebody who brings more of themselves and who are willing to take on roles which are more leadership oriented and have a greater leadership mindset. So this is just a brief. It's again, not very gender specific, but because we are dealing with a lot more women who are giving job interviews now, I'll give you some anecdotes along the way. So, first and foremost, it is very important to invest in a good resume. The, the resume reaches the corporate office before the candidate does. You should have a good 2 to 4 page resume. Everything from how it is formatted, syntax errors, grammatical errors, the fact that you've taken time out to actually get a professional photo shoot, you have a good photograph of yourselves, a well groomed photograph. Your resume can be built by AI tools now. If you go on LinkedIn and click jobs, and it has a resume builder, it'll format the resume for you. So to have a poorly formatted resume actually shows lack of mental application. You can really give links to YouTube channels, Instagram channels, surgical channels that you have created. It speaks about your initiative. So you have to showcase not only your academic qualifications, your surgical qualifications, but the fact that you take initiative. Because a corporate is looking for people who take initiative. Whether it is a social media initiative, an initiative you took by setting up a department as a senior resident or a young faculty, or an initiative you took to build a community program, right? All initiatives should also be part of the profile that you built. A lot of the interviews now are virtual because unlike fellowship where you can ask people to visit, it is not for a corporate profile. Sometimes the initial interaction is virtual. So it is very important. Please have the ability to ask for a time that suits you. The candidate may at that time not have a good internet connection. You may be logging on through a phone, and therefore the interview may not go as well. So request for a time and a place where you have the availability and the access to the internet. Also, you must learn how to use virtual platforms. These are some of the bloopers I would say for the interview. Sorry, I have poor connectivity. Oh, I've never used Zoom before. I don't know how it works. See, if you say something like I've never used Zoom before, it shows lack of initiative. It shows that you've never attended webinars, let alone participated in them. If you've logged in and then you say, sorry, I was in a rush, this is my kid's name, it's not my name on the account. It shows lack of those small detailing and application. Sorry, my phone is out of charge. Sorry, my computer is out of charge. These are things you should have taken care of because these are part of your first impression. Like ma'am said, appearances matter. You must dress appropriately. Too much makeup is a no-no because sometimes for a corporate interview, the corporate dressing should not be such a business dressing that it takes away from the doctor profile. You have to have an appropriate dress. Uh, if makeup is there, it has to be controlled. A white coat again is not necessary, but definitely don't walk in with a hoodie or jeans or sandals or floaters. That does not give a good impression. You must have an appropriate business attire. Often a very first question is, tell me about yourself. So all of you who are looking for any job interview as such should have a 2-minute introduction about yourself and try and at least make it a little personal and memorable and not fully factual. You should be able to answer that what is it that you're looking for, and you should know what is it that you are here to negotiate in terms of this is what I definitely need from this job and this is what I hope I get. Now, whenever you're talking to somebody for getting a successful outcome, you're actually negotiating. So negotiation actually has a three-part agenda, right? First, you have to connect with the person. Depending on the kind of relationship, depending on the seniority, the personal connect, the gender, multiple factors come in, but you have to establish a relationship with the person, and you should be able to communicate effectively with the person and expect the reciprocity of effective communication. After the communication and the appearances are checked out, you then have to look at creating a canvas on which you can negotiate. What do I mean by creating a canvas? For example, simple discussions are, what are your working hours like? For example, I say 9 to 6. You say, no, it doesn't work for me. I have a small child. 9 to 6 doesn't work for me. I need work-life balance. That is not creative. You can therefore look at creative options that I understand you need me 9 to 6, but what are the flexibility options that you can offer? You can look at what the organization needs. For example, the organization needs 9 to 6. You cannot do 9 to 6 because you have a small child. But can you offer them, okay, I will work for you on Sundays and I'll take a weekday off because the child doesn't go to school. For with a small child, a Sunday and a Monday may be equivalent. So you must engage in a creative construct rather than benchmarked. This is the number of hours. No. The flexibility, I will then look at stretching on a Sunday, right? Or I'm a retina surgeon. By the time my patients are dilated, perhaps I can do a 10 to 6, right? So these are the kind of options that you have to create by having an open discussion. Please don't talk with a closed mind. We had a recent interaction with somebody who said that your working hours are off. You have to accommodate work-life balance. 10 to 5 should be your new working hours. Now, that is something that is not a creative solutioning. The organization has certain needs. You must understand your needs and then try to co-opt your needs with them and be frank about it, but don't be really blunt and don't be rigid, right? You have to have a legitimacy to your need. So when you're talking about creativity, first please understand, is my need legitimate? Okay. You must explore the alternatives in your mind. For example, if you're really hell-bent that this is the kind of salary that I need and this job is not giving you that salary, then you must explore what are the alternatives, A, B, C, D, right? You must also keep in mind what are the alternatives the organization has. Today, for example, in a city which is a metro city, the organization may have many more candidates available. For example, a Delhi, a Hyderabad, a Mumbai, you may get more candidates. If you're looking at smaller tier cities from a Gaya to a Junjunu, the candidates available may be less. So you must keep in mind your negotiating ability also depends on the supply demand curve, right? So this is an important choice that you must make. Also, you have to have the creativity. For example, a starting salary of X is important to you, and the organization says that the starting salary of X minus 1 is what is available. But you feel that your values align, the workload that you want align. You may look for some mentorship because you may be starting out young, or you may look for independence. So if whatever else you want align, please don't stop without creating a forward path. If the starting path doesn't match, you take the leap of faith, take the initiative, you tell the organization, okay, this is not matching. But if I am willing to invest and take greater initiative, will you be able to match this for me after 1 year? So that will show your commitment. So all in all I'm trying to say is that most of the conversations we have are very benchmarked because we are used to in a business language not negotiating but often responding in straight answers. The negotiation canvas will be created only when you discuss freely without a closed mind but have the checklist of these are the must-haves. For example, surgical independence, ethical work, no pressure as regards commercial pressure, etc., mapped out. These may be the checklist for somebody, whereas somebody else may thrive under commercial pressure and is looking for greater financial rewards, right? So what is the corporate essentially looking for? We're looking for competence, which comes through education and training. And trust me, most corporates have the ability to get a good ref check done. So how you've treated your peers, how you've been with your seniors and juniors, it's quite visible in a ref check. Your confidence and your communications is something that can be assessed firsthand. Your aptitude of continued learning and a growth mindset is something that you must put across in the conversation that you're having. The ability to collaborate comes across not only from the ref check, but the fact that you don't have a closed mind. When you're creatively addressing and problem solving during the interview, you come across as somebody more collaborative. And a corporate is always looking for somebody who has the ability to work in a team. Commercial awareness is again an important point. Here, you should be open-minded. A lot of the VR candidates that we often speak to say that if you don't give us a Constellation, we will not operate. Constellation is a favored machine. A lot of institutions have it. But the commercial awareness of the cost of machines, the cost of packs, and how it influences pricing, these are things that definitely make the corporate understand this person is willing to take initiative. Don't make closed-minded statements like, okay, Constellation it is, or I will not do anything beyond this machine. If you don't give me this, I will not operate. That shows lack of confidence and lack of open-mindedness. You can, of course, later ask for the equipment, or if you feel that you definitely can't operate without it, then perhaps it is, but you should learn to have a greater range of equipments that you can work with. Never ever talk negative about your previous job. Yes, a corporate may like the fact that you are choosing them over another possible profile, but the fact that you are talking negatively about another corporate or another institute never augurs well, because if you're talking negatively about somebody else or some institution, it actually tells the corporate that you perhaps will one day talk negatively about that corporate as well. It is never a good idea to talk negative in a job interview. Maybe perhaps actually never a good idea to talk negative excessively anytime, but definitely not during a job interview. Don't sound too casual and uncertain. For example, if you're asked that, what do you want to do 5 years from now? I'm not sure. I haven't thought about it. It depends on what my husband does. It depends on what my wife does. Do not sound that casual. You have to have a plan in mind. You may articulate fully or in part, but you cannot just say, I have not thought about it, don't know. Take your time, think of a plausible answer. You may not want to get too personal, or you may not want to share details, but at least make it sound like it has been thought through. You must conclude with clarity on next steps, because interviews often end as an interaction. There are next steps, there are financial negotiations, there are contracts, there are notice periods, there are joining conditions. Multiple things have to be discussed with different people. At the end of the interview, you should have clarity. What are the next steps? When will you be informed of the decision? If the decision is informed, what are the next steps? When are you likely to be onboarded? What are the terms of onboarding? You have to end the interview with this clarity. You may not ask for all steps, but at least the next point of contact, the next step, and a broad future course should be available to you. Remember that you're building the foundation of a relationship with an organization in an interview. I'll give you the example of a candidate who has been leaving jobs every 6 or maybe a year. And in the interview says that, give me any location, I just want XYZ money. That is the first sentence the candidate says in the interview. So the foundation of that relationship will be very transactional. Another candidate says that I want to join the institute because I feel this will give me a canvas to grow, and I eventually see myself wanting to be the best surgeon of my generation. What does that give the organization? This person has a growth mindset, a long-term vision. Let's invest in this person with opportunities. So the organization can invest with a remuneration, the organization can invest with opportunities, the organization can invest with academic opportunities as well as surgical opportunities, or a mix of all of them. But what you lay out is really the foundation of the benchmark that has been set in the organization's mind, that this is the form of reward this person is looking for. The basic principle of human existence depends on reciprocity. The human race survived because of the barter system. We gave and we got. Whether giving came first or getting came first is not the question. You have to give to get. So please remember the initiative of giving or investing yourself in the organization or your job or your work definitely is what the organization is assessing, not only during the interview, but also later. The more you give, the more you get. This is actually a very primal human instinct, and this is how it works. So different people can have different experiences in their fellowship, in their corporate job. It is partly a reflection of the corporate, but largely a reflection of how well invested you are in that organization. Please note the contract. With private equity backed corporates, most corporates today are private equity backed, most contracts are on a stamp paper. They are a legal document. Please do not say that it was 5 pages or 10 pages and I chose to not read it. That is not an option. It is not so difficult that you need a lawyer, but definitely you should go through the contract. Certain contracts come with a lock-in period. They may be locking you in for 2 years, 3 years, etc. At our organization, we prefer to not have a lock-in for a routine corporate job, because if a person wants to stay, a person wants to stay. If a person doesn't want to stay, they don't want to stay. But increasingly, the lock-in period is something that is showing up in contracts. The notice period also, if it's longer than 2 to 3 months, it sometimes, if it's 6 months, it may make it very difficult for you to switch jobs, because the future employer will not have the possibility of waiting for 6 months to have you join. So please look at least these two things, the lock-in as well as the notice period, and read your contract, and don't tell yourself that you are not a lawyer, because it is not that difficult. Once you've had a job interview, sometimes virtual, sometimes physical, face-to-face, when you do show up at work, please match the expectation. If you've dressed up for the interview, it is very important to be the same person at day one of your job. From the point of view of gender, actually, truthfully, a lot of the applications that are coming today are women, because there are more women in ophthalmology. So I recently went to business school, and we had a batch of 36, and most of them were men. We were very few women. And the professors jokingly said, do you know we accept 30% of the women who apply to us and only 9% of the men? Why was that? Because all institutions that scale or are sustainable look for diversity, right? So diversity in the business world is actually helping women, because we get a greater representation because there are fewer of us. But in the ophthalmic world, definitely we also try to create a balance. So if we have a male CV and a female CV, let's call it that, though we are gender agnostic, most people are, but to create a balanced profile in the organization becomes important. So therefore, as women, you have to understand that if you limit yourself in flexible hours, the organization can only give so much flexibility. So we have to create a group that is able to balance each other's needs out. That is the reason men and women in equal proportion actually work well. So sometimes, being women, if you're getting a job opportunity that you like, just because you're not getting that tiny flexibility in the hours, you may actually need to think that, is it worthwhile stretching? If you do stretch, I promise you, you will find a solution. I'll just end with a story very specific to women. In a circus, if you've seen a joker juggling balls, right? So first they juggle 2 balls, then they juggle 3, then they juggle 4, right? That is the way if they have to learn to juggle 4 balls or 5 balls, they actually tell themselves, if I have to be a master at juggling 3 balls, I will start juggling 4. Because the day I start juggling 4, 3 I will master. So, as women learn to juggle more, we can do it. Add that extra ball in your life, and you will be able to stretch. The organization, once they see your initiative, will be more flexible. Sometimes you have to be less upfront about asking for all the flexibility and know that with your hard work, you will earn it. That's just the tip I would want to give. And good luck to everyone. Hope we build a
Thank you
better
very much.
economic world.
Thank you, Dr. Ritika. It was an amazing talk, and especially with the INSEAD background that you have, I'm sure there are lots of management skills, on the other side of the table are also involved in that. So I'm sure the postgraduates and or even anybody who's facing an interview or a job, this would be highly benefited. We have Dr. Mahesh Babu here with us. Dr. Mahesh Babu, your thoughts on this?
Good evening, madam. Thank you for having me here. Yeah, madam covered most of the things and all are important only. So I feel in any interview, especially for job interview, we did not project ourselves as a perfect doctor, rather a honest doctor. If at all we're expecting a long-term relationship with any institute or corporate, whatever it is, it's a medical college or corporate office, that projection yourself as a honest person, it'll help. Maybe as madam said in almost our last slide, like what is expectation, what is reality. So their expectation should match what we are. So like we should be honest with ourselves, what are our pros, cons, so that should be clear. And one more thing what I want to say is terms and conditions. You must be clear about the terms and conditions, whether it matches with their terms and conditions. You should be clear so that in future you will not have any surprises, or they should not have any surprises. And then
True.
coming to previous talk, Mona madam's talk, I wanted to add one point. If any person who is going to appear for fellowship interview, if they're as clear and as calm as Mona ma'am's presentation, definitely they're going to make it through.
I know. If you imbibe 10% of her,
Yeah,
whatever she said,
definitely,
that'll be enough
definitely.
to clear the interview
She was
in
so
total.
composed, the tone, everything was perfectly matched.
Right.
Just observing a presentation, and no one would dare to reject such candidate.
Correct. Dr. Aarti is with us. Dr. Aarti Hida, your thoughts on this, please.
Yeah, so good evening, everyone. Thank you, Dr. Ridhima, for the invite, and thank you, Mohita ma'am, for starting this young WOS group. So I will just try to cover both the things. I wanted to add few points for the interview as well, for the interview of fellowship as well. So preparing for a fellowship interview and a job interview is entirely different. For a fellowship interview, you have to project yourself. Not, I mean, you may not be knowing the subject completely, but you should project as if you are there to learn. But when you are applying for a job interview, you cannot go and tell that, I don't know this, but I want to learn this. So your confidence will be different when you are talking about a fellowship interview, and it will be definitely different when you are talking about a job interview. You can dictate your terms when you show that confidence. But if you feel that your job interview is just started, the discussion has started and the terms are not matching, or you're expecting better salary, you can always tell that, is there a way that we can sit again after 3 months, and maybe 3 months I will need to prove my ability to be a part of this team, and then maybe revise the salary. So the way you project yourself, your body language matters a lot, whether it's a fellowship interview or a job interview. Ritika ma'am has covered all the points in great detail, and I'm sure I really don't have anything else to add.
Yeah. Sachi, your thoughts on this? Dr. Sachi, you would like to add on this? You're muted.
Good evening, ma'am.
Yeah. Yes, Swati, you can.
Yeah, it's fine
Yeah.
now.
Yeah.
Thank you so much, ma'am. And thank you, Mohita, ma'am, for giving me this opportunity to be a part of this webinar. And definitely, it's a very informative talk. Though I have worked in the government sector only and I have an experience of government sector only. But yes, whatever Ritika ma'am said and Muna ma'am said was absolutely correct and to the point. And definitely, one thing which I really feel is that the candidate should know his priorities well, should be well focused, even if it is for a fellowship job or even if it is for a corporate job. Because if you are stepping in a corporate world, you means you are embracing all the pros and cons and you're ready to give your utmost dedication to the organization. And definitely, as Ritika ma'am said, that your way of speaking, your way of communication matters a lot. And I feel that matters a lot in the interview. Your body language, your confidence, your communication, your presentation conveys it all to the interviewer. So you should be very clear when you're going for the interview. You should answer them well. And obviously, your answers should be focused and they should depict yourself in honesty. Whatever reply you give should be honest. This is what I feel
Thank you,
for all the
Sachi.
kind of interviews.
Yeah. Rishi, you have faced the fellowship interview and you have faced the job interview at the two most premier institution. I correct myself here. So what is your take on that?
I think you cannot add anything to Ritika's talk. It is so perfect, actually. Covered every aspect
Right.
so nicely.
Yeah.
Management school was
Correct.
covered in
So
every
that's what
point.
I said, NCR
Yeah,
speaking.
I think it was perfect, and
Yeah.
every point was covered. Really, there's nothing to add. But I think, like was mentioned by the previous speaker, it's very important to know your priorities and communicate that well to your employer. And again, you have to be honest about what you can do and what you can't do. You have to
Right.
press the part and be serious, show
Yeah.
your seriousness.
It's two different, altogether. It's a fellowship interview is different, but the core is the same, right? Dr. Mohita, your thoughts on anything you would like to add for the benefit of the youngsters? You're muted. You're muted. Yeah, yeah.
These were excellent talks. I'm still trying to imbibe in everything that both the speakers had talked. And just like Dr. Mahesh Babu said, Dr. Muna's talk was totally calm, composed, and Dr. Ritika's was absolutely opposite, full of that corporate energy. So, but one thing that was common to both the talks was that you cannot go to the interview unprepared. And most of the times, we find that they do come unprepared, whether it is in the form of dressing up or it is in the form of what questions are expected. And one very important point that Dr. Ritika has put forward was when they are asked that what are your future plans, generally the answers, and especially for women, the answers are, I don't know, depends upon where I will reach when I'm married. It depends upon what my husband will be doing, or depends upon, even if it's not this, then also they say, I don't know, and they look around. So that itself shows that there is no clarity of thoughts. And the second thing I really liked about this was you can ask for what you want, but you should be going with an attitude of what can you give. Now, and you can give them alternatives to, okay, I cannot give this much time, but I can do this for the institute. So that itself shows your attitude as you're thinking about the institute also, and you're not just thinking about yourself. So some of the points are so good. I feel I'm happy this is being recorded and this can become so useful to so many people. So now everybody knows how to how to ace an interview when you go to CFS and how to ace an interview when you go to SN. So I'm sure the young women ophthalmologists as well as men. So it's a young WOS group, but many of these topics are supposed to be inclusive. It's not that it's only for women; it's for both women and men, and they must be happy with all these tips.
True, very true. So I think it's most important that you are very good at one skill that you can impart to the institute and probably imbibe the best of what is around you. Ridhima, over to you.
Yes.
for this?
Yes, ma'am. Thank you very much. So we've had two wonderful talks from the point of view of the interviewer, but now we are going to the opposite side. We have 4 young women ophthalmologists, and kudos to their courage, enthusiasm. They've prepared short reels, and this is from the point of view of the candidates going for interviews. I'm going to request Dr. Prasanna Ramesh to introduce our first young ophthalmologist.
Thank you. Thank you, Mohita ma'am and team WOS and the YO wing for the opportunity. I would like to call upon Dr. Jui Garkan, I hope I'm pronouncing you right, from Ahmedabad, Associate Consultant.
So I'll play her reel.
Yeah.
My greetings to all beautiful ophthalmologists. The one thing which I believe is to crack any interview, you should be prepared of some common questions. That is basic introduction of yourself. Why they should choose you only? What are your strength and weakness? What is your field of expertise? And the last tip I would like to say is always have a good eye contact with the interviewer. It makes a difference. And always take a time of a second or so if any complex question is asked to you. That's all right.
Thank you very much, Dr. Zui. I'm just a reminder for all our panelists that you've been given a mark sheet to mark all these reels that you're going to see, because it's a contest for all the efforts that they've put in. Any comments from Dr. Kirti Singh about the reel that we just saw?
My greetings to all beautiful ophthalmologists.
She's not there, Ridhima.
Okay. Dr. Zui, do you have any comments about the reel that you put in? Are you here, Dr. Zui?
I think we just play the reels, Ridhima.
Yes.
Yeah.
Yes, ma'am. I'm here. Actually, I'm between legends of ophthalmologists right now here. So I feel like Wonder Woman, Iron Lady, everybody is there, and I feel that I'm between the team of Avengers. So it is my high privilege. It will be better if I will allow all of you to speak rather than me. Thank you so much for giving me opportunity over here.
Thank you very much, Dr. Zui, for your reel that you put in. Dr. Aarti, do you have any comments?
I think she has given very crisp points, which will be good for someone who has really less time to just see the reel and take home points will be there. That's it.
Okay, we'll move on to the next, Dr. Prasanna.
Yes, ma'am. So next online we have Dr. Shraddha Adsal, ophthalmology consultant at NSSCH Panvel. Yeah, over to Arvind.
Hello, doctor.
Hello, sir.
Just quick question. What do you do when the surgery doesn't go as planned?
So based on my experience, the first thing I do is to slow down because rushing and panicking just make the situation worse. I consciously and carefully perform the next step.
And if you're unsure about the next steps or complications?
So if I don't know the next step or I am unable to manage the complication, then I clearly communicate and ask for serious help.
Don't you think it sounds like lack of confidence?
So I see it as applying training correctly because in surgery, judgment matters more than the independence.
Okay, thank you.
One practical tip from my side, during interview, talk about how you handle the pressure, not the procedure. That's what tell interviewer they can trust you in OT.
So thank you very much, Dr. Shraddha, for the role play as well as the practical tip at the end. Do you want to add something here?
Not much as of now, ma'am, but I'm thankful for the opportunity. And this is what I failed, and that's why I asked the question, which I think we should answer this type of question, which are direct and genuine in cases. Thank you.
Hello, doctor.
So I think we'll move on to the next reel.
Nupur ma'am,
Yeah, so our next participant is Dr. Vibha Singh. So she's an assistant professor at Department of Ophthalmology, Santosh Medical College, Ghaziabad. And over to her reel, please.
Very good evening. Myself, Dr. Gabasi. In our life, we just face many interviews as some worker and some were working as a teaching to us. For example, during an interview, they asked me what motivated to apply for this role. I told I have been rejected many times. I just repeat, I have been rejected many times, but I still believe I can add value somewhere. I want to grow in a place where my work matters. They answered, what if you they are where they are not going to select you? I just smiled over there, and then I will try again. Quitting would quitting. I mean, if I quit, it means I stop believing in myself. So the type of interview, you have to believe in yourself first. Then they again ask me, what makes you different from others? Why should we select you? Most people say, I am very hardworking, reliable. That sounds good. You are working, you are reliable, but sound like everyone else. So they want a proof, not your personality. Instead, you can say it by another way. One thing makes me different. One thing makes me different. I can solve the institute problem, institute your hospital problem, and I can save the institute. So interview is not about your traits, it's about how can you give result to any institute or any hospital. So thank you so much for giving me this opportunity. That type of interview, you have to believe in yourself. So thank you so much.
Thank you, Dr. Vibha. That was really wonderful, especially, having the confidence in yourself part. So a few words from you before we move on to our next. Dr. Vibha, if you're there.
Thank you, Dr. Nupur, and thank you, WOS, for giving me this opportunity. As WOS always comes with a out-of-box idea. No one is going to believe in you until unless you believe in yourself. So believe your best. There will be no regret from your side. In spite of that, if you fail, then accept your failure and move on. And just believe in yourself and improve you day by day. Thank you. Thank you so much.
Thank you, Dr. Vibha. Dr. Ridhima, are we taking the comments from the panelists or we move on to our next reel?
I think we can take one. Yeah.
Yeah, so maybe Dr. Rishi, if you can just give a comment on Dr. Vibha's reel. So you're on mute, sir.
I like the point that even if you've previously been rejected, you're not giving up, and you're showing that you're persistent and willing to pursue what you really want, and that can come through in your interview.
Thank you. Thank you, sir. Over to you, Dr.
Thank
Ridhima,
you,
for
sir.
the next. Yeah.
Vibhuti?
Yeah. So the next doctor I would like to invite is Dr. Vishakha Sangewar. I hope I'm pronouncing you right, Dr. Vishakha. She's a consultant at ABO Eye Institute, Nagpur. Over to you. And her reel, sorry.
Tips on do's and don'ts of facing an interview. Hello, ma'am. Nice to meet you. I'm so glad. Hello, ma'am. Good morning.
Good morning, Dr. Vishakha. So tell me, where did you...
I did my MBBS from ABC College. I did my PG from XYZ College.
Do you have any exposure to phaco or femtocataract surgeries?
I did around 150 SSCS. I did around 50 pterygium. I did...
What are your clinical skills?
I can attend each and every patient. I can perform every investigation. I can perform every surgery. I can do everything. Thank you, ma'am. Looking forward to work with you. Thank you. Thank you. Have a nice day.
Thank you very much for that wonderful reel. Can we have comments from Dr. Mohita ma'am, please?
I think she really demonstrated how it should be done. And this is so very right. How you sit, how you place your bag, how you conduct yourself is very, very important. And the way she was answering, I can do this, I can do that, I can do this, is what is not called for. And this was exactly how we wanted the reels to be, in the form of a role play as to what is right and what is wrong. And these small things do make a difference, just as she has shown, as to how you're supposed to behave. So
Yes, wonderful, ma'am. So I think we've come to the tail end of our webinar, and a very big thank you to all our speakers for their wonderful, valuable insights, honest, beautiful pointers, and to Dr. Mohita Sharma ma'am, Dr. Swati ma'am for their inspiring leadership, their remarks, and to our judges for sparing time, to all our contestants for their enthusiasm, and thank you to everyone who attended for making this session impactful, empowering for all of us. So I think if we can have a group photo.
And before that, thank you to you, Ridhima, and to Nupur and all the Young WOS team who's here, Rakhi,
Prasanna, Vibhuti.
Prasanna, Vibhuti, you all
Yes.
have been too good. You are actually like, ever since Young WOS started, we started actually feeling old the way you all work, and you're so fast at everything. It's like we tell you something, and the next 5 seconds it's done.
You make
Before
us
you
feel old.
blinks. So, but
No,
yes,
no,
we love
not
your
at all.
enthusiasm.
Right.
And the best thing about all this is that you're doing it for your fellow colleagues, which is the best thing, because so many are learning so many things because of all the efforts that you are putting.
Thank you, ma'am, for this opportunity and these ideas. So, Mr. Sharik, are we ready? If you can help us with a group photo.
Already done, ma'am.
Okay.
Okay.
We were not prepared.
We were not ready.
After Ritika's talk, I was scared because somewhere my net was not working, and somewhere my my numbers were not correct.
Ma'am had a post. Ma'am, I think Nupur ma'am was having a post for WOS.
This one, ma'am, we'll do this.
W.
Yeah.
Yeah, we could do that.
Mr. Sharik, one more.
Okay, ma'am.
Okay, I'm holding my phone in my other hand, so I don't know if it's visible, but yeah, there you go.
Can you tilt your phone, sir, horizontally? If you can tilt your phone.
It's done.
Oh, yeah.
ma'am.
Yeah.
Please tell us when it's done.
It's done.
Okay, thank you.
Thank you.
Okay, thank you very much.
Thank you. Thank you, everyone.
Everybody.
Thank you so much, ma'am. It was a fun being part of this.
Whom do we have to give the scores to?
Yeah.
Dr.
So
Ridhima, you send the mark sheet to Dr. Ridhima's
Done.
WhatsApp.
yeah.
Thank you.
Okay. Thank you.
Sent it.
Thank you.
Thank you, everyone. Thank you so
Bye-bye.
much.
Thank you, everyone.
Bye.
WOS
Good
state
night.
heads can stay behind. We have a small meeting. The WOS state heads, please stay behind.